Hi, good morning. This is Dr. James Dugal, board certified emergency physician here at Stat Medical Care. What I'm going to do is I'm going to take you around for a very quick tour and show you what we've done to protect patients and staff from the coronavirus and separate patients that are sick and well and taking care of them. We've been extremely busy, but we have some time now, and we're going to just walk through. Come on and follow me. We're entering the area where it's going to be part of the triage as we get busier. We're going to have an outside triage, but right now the weather was raining, so we moved our triage inside. Come on in. The patient will come to the door, but that's only if they're not with a cough or a high fever. If they are, what we do is we bring a face mask to their car, and then we escort them into the building. Come on in, and this is our triage center. Say hello. This is Nicole in our triage center. And what Nicole does is the patient will come in, and she'll not only ask questions, but she'll get temperature, pulse ox, and pulse. And if they do have a sore throat, a cough, or a temperature, what we'll do is separate immediately. She'll escort them into our sick area, which is our area for all upper respiratory, lower respiratory areas. But if they aren't, if it's a laceration or something else, hypertension, what we'll do is go to the well area where there won't be any sick patients. As we go in, we'll come in to our area here where we have our intensive care area. Here we have a 2-bed intensive care, and then we have 9 beds. We have a 9-bed facility on this side. And this is what we're going to keep people away on this side who are well or who are chest pains, etc. Follow me. We'll come into the area here. This is a well area, but this is our infusion area for IV infusions, for antibiotics, for dehydration, other things that we need to do with patients who need IV therapy. But no potential coronavirus or pneumonia patients are on this side at all. So as we go back along, we'll look through our window here, and this is our office, and the window is closed. You cannot open, and they're in their personal protective gear with gloves, etc., for not only their safety, but the patient's safety. We're going to walk over here to our sick area, and where you'd be escorted by one of our triage people into our sick area. We follow into the tunnel, which is walled off completely from the part of the clinic on the other side, so there's no particle movement. As you come in, you're coming into our area here, which is our sick area where we see the patients. It's enclosed. These are just where the patient can sit. They're not all going to be in here. It's one at a time. And we'll see the patient. We'll do flu tests, strep tests, A and B, flu A and B. We do nebulizers. We do essentially everything we need to do in the emergency room for the upper respiratory flu. And we can't test coronavirus yet. We're getting tests in that were just ordered today. We'll get about 200 tests. We're going to follow, this is a 3-bed area for IVs for our sick people in this area here. We repurposed our dermatology side just for the pandemic. These are our areas that we're going to be using here. I'll just show you 2 of the many rooms for our sick area that we have, and it's very quiet and calming. And then we have our laboratory, our second lab. We have 2 labs here. Our second laboratory is down near where our 3rd room is. All right, so this concludes the quick tour, and this is the exit for our sick patients. They don't have to go back into the clinic to expose themselves or other people to any upper respiratory, lower respiratory, coughing, positive flu tests, positive upper respiratory and particles if they're coughing. Everyone's in a mask. Our patients are in a mask. And it just gives you an idea. This is just a quick idea of what we're doing here. There's more to it. But I want everyone to know it's safe to come in It's if you have asthma and you have no fever, etc., you're on the other side. If you're coughing and you have a high fever, you're on this side. What we're going to be doing is doing a report each day. I'll do another video and we'll give an update to all our patients. And everybody wash their hands. Do not touch your face. We'll see you later, maybe tomorrow or the next day. This is Dr. Dougal. Have a great day.